Logging in. Good evening, everybody, and welcome to the PEAS-CAT meeting. Thank you for joining us today. We have an agenda up on the screen, and we're going to go ahead and get started with introductions. So we'll start with the CAT members. When I call your name, just let me know if you're on the call. So we'll start with Andrea Amico.
Hi, yes, I'm here.
Thank you. Karen Anderson, let us know she won't be on the call today. So Michelle Dalton. Elena Davis. Rich DiPentima. Senator Martha Fuller Clark. Tony McClellan.
Yes, good evening, I'm here.
Thank you. Bill McQuillan.
Good evening, I'm here.
Thank you. Joe Ryan.
Good evening, here.
Thank you. Jared Sheehan. Okay. Mark Sullivan.
Here.
Awesome. And Shelley Vetter.
Yep, I'm here.
Thank you. We'll move on to our technical advisors, Dr. Kerrigan. Dr. Durant.
I'm here.
Thank you. And Dr. Shader. Okay, we'll move on to our ATSDR staff on the phone today. When I call your name, if you'll just quickly let us know your role, your title, your position, and your role. So Dr. Chris Ray.
I'm here, Associate Director, ATSDR.
Thank you. Captain Summers.
Tara Summers, ATSDR Region 1 Regional Director, and also on the line listening this evening is Chris Mugford. He's our new ATSDR Region 1 staff, so you may see his name on emails or coming up in the future. So just if you see that name, you'll know who he is.
Thank you, and welcome to Christopher. I know that you're excited he's there to help you out in Region 1.
Yeah.
Dr. Marian Pavic.
Good evening, this is Marianne, co-PI, Peace Study.
Thank you. Dr. Frank Bove.
Good evening, I'm co-PI on the Peace Study.
Thank you. And I want to introduce you to a couple new members of our PEAS study team at ATSDR. First, we have Tira Barrett. She will be taking on the responsibilities as the PEAS-CAP coordinator. So Tira, I'll let you introduce yourself.
Hi, everyone. My name is Tira Barrett. I'm with ATSDR and I'm the special assistant to Dr. Ray. I'm glad to be working with you all.
Thank you, ma'am. And our other new team member for PEAS study is Dr. Katie Egan. She will be the PEAS study program manager for the PEAS study. I said that. So welcome, Katie. And if you'd like to give a quick introduction as well.
Sure. Good evening, everyone. I'm Katie Egan. I am coming on as a project manager for the PEAS study, new to ATSDR.
Thank you to both of you for taking my place. I'm going to miss everybody, but y'all are in good hands. So thank you guys. Pam Whiten, would you just introduce yourself as well, please?
Yes. Hi, everyone. This is Pam Whiten. I'm in the NCH ATSDR Office of Communication. Thank you.
And she is our Zoom guru. So I want to thank her publicly as well for helping on all these meetings. And I want to back up for technical advisor, Dr. Shader. I see you're on.
Hi, good evening, everyone.
Hey, good evening. All right, we'll move on to our contractor help with APT. Danielle.
Danielle Hunt, project director.
Thank you. And Zuha Jetty.
Yep, this is Zuha, project manager from that side.
Thank you. And thanks. I didn't see Kate on. Is she on?
No, she wasn't joining.
Okay, great. And last but not least, I have on my list is Colonel Holyfield.
Good evening, Colonel Freeman Holyfield, Air Force Secretariat.
Okay, I think we have captured everybody that is a panelist on our call. So let's go ahead and get started. I did want to say welcome to any community members we may have on the call. And you'll notice on the agenda, there is a place for questions from the audience after the PEAS study update. And we can also circle back around near the end of the meeting to make sure we didn't miss anybody as well. So with that, let's go ahead and get started with the PEAS study update. I'll provide a quick update and then I'll ask for a few other people to give some updates as well, that maybe I missed. So for the PEAS study, we ended our recruitment on 12/31/2021. And our office closed on MPs on January 31st of this year. Currently, we have our samples at the labs getting processed. And so those are the main updates, but I want to see if our co-PIs, Frank or Marion, have anything to add to that.
This is Frank. There is a physician education that we're planning sometime in April. So that's one update. We're also in the process of doing data management. I guess if Marion can jump in if he wants. We're doing some data cleaning. We're waiting for, as Jamie mentioned, we're waiting for the PFAS samples to be analyzed. There are some 500, I think, samples that still have to be analyzed. And we're also waiting for clinical results from one lab as well.
Marion, anything to add to that?
Yeah, I can provide a little bit more detail on that. So with the apt contractor, we've been discussing the analysis of the clinical samples at Sunny Upstate Medical Center lab, and trying to get some estimates when their data or their results may be reported. And it looks like that they may be able to finish sometimes in March. So we hope that that goes as planned. They have received all the samples in good conditions. So they're working on that, and we hope that they'll be reporting as they indicated in March. So that's one part of data. We do have most of the LabCorp data. As Frank said, we have partial data sets at this point. So what we're focused on in a data management part is trying to get all the data in. We had some preliminary data fulfilled in September, then in November. So it includes data on participants as they were coming to the study through that period of time. So what we're working on is twofold, is to try to get all the data in for everybody that came in through the end of December, and also do other things, continue verifying the important part of the study is to verify their reported health conditions. So that is still ongoing. But as I said, the idea is to get the data, or the data that we have, to work on working on that study data set, to have data on all participants that were in, and all that is in progress. And we'll be continuing doing that over the coming months to making sure that all pieces of information are complete, and which they're not at this time, but we're making progress. The other part that Frank mentioned, and I have mentioned on previous calls, is that DLS, National Center for Environmental Health Division Lab Sciences, where the PFAS analysis are done, we've been operating on quota capacity throughout the pandemic. So there's clearly some delays there, and they're still waiting for all the staff being back full. The lab cannot work without people being at work. So CDC did get some dates for getting back. So sometimes early mid-April, we'll have better understanding. People should be in lab by that time. The data, the samples are with them, most of them. Some of from the December and that were shipped December, January are still at data at the CDC biorepository, need to be transferred to the lab. So we're still working on that, as they didn't take the usual route. So from the latest discussions with the lab, we hear that summer, that something like July seems to be something that they, even with uncertainty, that there exists, that they would like to report the results to us in that time frame. If anything happens sooner or we get a better estimate, we'll be informing you about it. Thank you, Jane.
Thanks, Marion. Katie, I know you're relatively new, but I want to give you a chance if you have any thing to add.
I do not. Nope.
Okay, great. Tara, do you have anything from Region 1 to add to that update?
For the study? No, I don't think so.
Okay. And do you have anything to add to the Peace Study update, Danielle or Zuha?
Yeah, this is Danielle. I'll just add a couple of things. One is that while the in-person data collection has ended and the office is closed, we are still doing some medical record abstraction and follow-up with schools to get information for anybody that indicated a follow-up was needed. So we are still working through that process, and we are also preparing to send out a letter this week to all the participants, letting them know that the study has ended in-person data collection and the office is closed, and we are providing an alternate contact should anybody need additional information. They have the CDC.gov Peace Study email address that they can use, since other forms of communication will have been shut down with the office closure.
Yeah, thank you for that update. Was there more, Danielle? Did I cut you off? I'm sorry.
Nope, I was just saying that's all.
Okay, good. All right, with that, it's the update of the Peace Study. Are there any questions from the CAT members? Andrea, go ahead.
Hi, thank you very much for that update. So I know that there's delays in the lab, and I think that's understandable, but I was just curious if there's something more tangible, like in terms of a timeline that we can give people, because I have had a few people reach out and ask when they can expect to get their results. So like, do we have something that we can tell them other than lab delays and they're coming? Is there any more detailed information we can share with the community?
So as I said, we're still, to release clinical data before, all this is complete. So as Frank mentioned, the call is in the process of being scheduled in April, and we expect that we'll get the SUNY results in March. So we believe that sometimes in the April window, we would also be, we should be able to, get the clinical reports out. So that's the update on.
Okay, so I'm sorry, I guess I didn't understand that. So in April,
Right.
you expect that you'll have the clinical results. That means the non-PFAS results. You think all study members will have their clinical results by April?
As I said, depending on receiving the results in March from SUNY and on successfully scheduling the clinician, training and presentation. If we have that available, we would like to start sometimes in April sending the clinical results. Yes.
Okay. And then what about the PFAS results?
As I said, for PFAS results, we have sent those that we have received, which is almost half of all the results. So people already have those results, 395. We can only send those out when we receive them from DLS. As I said, the estimate that we have right now is for July of this year.
July, okay.
So
okay,
it's more than delay. I think we've been fairly specific.
Okay, I apologize. I didn't pick up on that when you were reporting that earlier. It could be,
Oh,
it might
no
be
worries.
helpful if you could put your camera on, Marion, too. If we could see you, it might be easier to follow a little bit easier.
Didn't realize we were on.
Did you have another question, Andrea?
I have some other comments. I don't know if that's if it's the appropriate time to bring it up, or if others have questions and they can go first.
Is it related to the Peace Study or?
Yep.
Go ahead.
Okay. I just wanted to check in and get an update on longitudinal study. I know the Peace Committee has always advocated for a longitudinal study, you know, and we were told initially that this would be cross-sectional and you start with that and kind of depending on what you find may justify more longitudinal efforts. But I do think that is something we've been clear about what we want to understand the effects of PFAS over time versus just kind of the snapshot. So, so just curious if there's an update or if ATSDR is considering this, because I guess for two reasons. I mean, number one, there's obviously going to need to be funding that needs to happen for that to be done. And that's something that, you know, we would want to, you know, as a community, talk to our congressionals about, as that's been an effective mechanism for obtaining funding in the past for the PEAS study as well as the multi-site study. And then also, I think one of the things that we really learned from this process is that the longer that time passes, where we have people's, you know, captive attention, like the less chances we have of bringing them back for the study, you know. So when we think about how many people participated in the blood testing program, you know, it was almost like 2,000 people, you know, at the end. And then it was like trying to pull people back several years later for the study. You know, it was a lot harder to get people to come back. And where we kind of have this captive audience of all of these people who have participated in the PEAS study, thankfully we have their contact information, which was certainly a barrier, you know, from the blood testing data. But I don't want to let too much time pass. And I just want to make sure that we're being as proactive as possible if we're going to start thinking about any longitudinal components, that we can start working on funding, we can start working on engaging with the people that we already have their captive attention, so we can consider any longitudinal efforts to study the effects of PFAS over time.
Thanks for the question. Chris, do you have any updates in longitudinal study?
So in my, excuse me, I'm sorry about that. In my discussions with Pat, we've talked about this. We want to see some of the data first before we make a decision. We'll definitely keep you informed, Andrea, as we make decisions on this, but it's still something we're considering.
Okay, great, thanks. And then I just had one more question. Frank, you mentioned physician education in April. And I'm just curious, like, what would that look like? Is that virtual? Is that a webinar? Are you sending letters to physicians? Like, what type of education does that entail? And then also just in relation to that, the National Academy of Science is working on their committee of, you know, guidance around PFAS and blood testing and, you know, medical monitoring guidance and all that. And the last I had heard from that group was their report was probably expected in June. So I'm just curious, like, how, if there's any new recommendations that come out of the National Academy of Science, how that may play into physician education within not only the PEAS community, but the multi-site communities as well.
Frank, if it's okay, can I throw that to Tara to speak to the physician
Yeah, go
education?
ahead. Go ahead.
Okay.
Yeah.
Hey, this is Tara. So we have had discussions with the group within ATSDR that's developed the materials for clinician education. They also have some materials that are currently in clearance that would be an update to what we currently have. And I've been in discussion with our New Hampshire apple tree partners, you know, the folks that sit at DES and DEP, because we recognize that PEAS community, we'd like to do clinician education there, but also since other communities have PFAS impacts, you know, as you know, like the Merrimack area community, we'd like to make sure we're targeting certainly the PEAS area for when the study results are about to be released, but then also sort of the other areas in New Hampshire where clinicians could use some additional outreach because of PFAS in the communities. So, and New Hampshire does have plans to, they're going to do a presentation to a nurse, it's like a nurse practitioner group. And so we're trying to see how we can coordinate so we're not duplicating effort, but also getting out as much information as we can. I think we all recognize it's a challenging time with COVID, you know, getting to clinicians is a little, getting on their radar is a little challenging. From the PEAS study, we do have from the work that was done there, the list of providers that the study participants cited as who they're going to for their healthcare. So for PEAS, it's the study anyway, it might be a little bit easier to target them specifically with some outreach materials, at least to for awareness, to say like, we did this study and the results are about to come out and here's the resources we have. I know the national, unfortunately, the timing isn't lining up exactly right with like the National Academies work, right? Because it seems like our study results might come out a little bit before that National Academies work. So I think what I would say is I don't see, if we do outreach in the spring to the providers who we know were referred to for the PEACE study participants, I think we could then do additional outreach again in the summer when the new materials come out. You know, I don't think this will be our last time to try to reach clinicians. I don't see that happening because, you know, the material keeps updating.
Okay, yeah, that's good to know that, you know, even if you make an outreach in April and something changes in June, you'd be willing to make another round of, you know, outreach efforts. And then, so understanding the challenges of COVID right now, particularly for the healthcare community, are you planning to do Zooms with them, or I wasn't clear on how you're doing the outreach?
Yeah, I think that's a good question too. You know, I think this spring we'd probably start with trying to do some like targeted emails or mailings to them, because I don't think we're going to have the materials ready to do like a grand rounds or anything to offer, you know, any continuing education to clinicians. You know, that's what really gets clinicians to engage, is like that continuing education piece. So, you know, we could at least start by saying a mailing or email, here's the study, what we did, and here's some materials for you. And I know that doesn't really address it all, but it's something that we can do in the short term that isn't a very heavy lift, and hopefully get some of their attention. And then we can, when we have more materials that we can share and potentially do something that we can work to maybe get them continuing education credits for, that would probably be the time to really, you know, hit hard to get the word out and get them to engage. Because grand rounds, it can be a little hard, even if you're partnered with like an organization like Dartmouth-Hitchcock, you know, which is one of your bigger, right, organizations. Sometimes to get on their ground round schedule takes time, and we have to prove that we have materials that we can get the CEUs for. So it's a little, we're working on it. I know that's not probably as satisfactory an answer as we have it ready to go, but it is in progress. It is something we want to do.
Okay, and I think, I mean, one thing, I don't know if it can be considered is, can you put some information in the results to the community about like resources for their physicians to go and find more information? You know, is that possible? Not just like, here's your results, follow up with your doctor, which people may want to do. Is there something we can do to?
So that is, if I may, so that is exactly what those emails to the physicians would be doing. They will give them these resources, which are already, you know, approved and are publicly available on the ATSDR website, but most physicians are not aware that those are available there. So being able to target all those physicians that the participants reported on their health outcomes that they reported and that we verified with them, we would be able to give them that information, that there is clinical guidance released by CDC. Recently, as we mentioned, there's a short version of that so that the physicians could use that as a short fact sheet, 3-page, to have some idea. What we want to achieve here is that we don't have physicians that never heard about PFAS, and participants comes in and they've never seen any information about it. So we want to, as Tara mentioned, we're going to email them or mail them that, and it does include the materials that are already available on the ATSDR websites and the links to those. And also, as the times goes, if there's new materials, there can be added. So for exposure assessment, there's other materials, as Tara said, that are in clearance. I don't know how much more helpful those could be. We do think that the resources that are on ATSDR websites are quite useful. They're longer, shorter versions of different documents. They may not be necessarily completely up to date, but we do believe that having that information that was already developed for the physicians, you know, is helpful to them, and having different versions also helpful, even if it's information from 2021.
Sorry, go ahead, Andrea.
I just had 2 follow-up questions to that is, you know, I know that I don't have the email address to my doctor, right? So I did give my kids' pediatrician's like phone number and I believe address. So if you don't have email addresses for doctors, how are you going to get them that information? So one other point, I guess the second point would be, you have email addresses and contact information for all of the participants in the study. Can you give them the physician guidance too? So in case their physician didn't get it, they're armed with something that they can take to their doctor and say, hey, this is a resource you can look at. Can we hit it from both sides is what I'm trying to say, because I worry that doctors are busy. Maybe they're not going to read an email or they're not going to look at a mailing that comes into a practice. But if they have something a patient can, if we give the patient something that they can take to the provider, that would just be another way of making sure we're providing the right people with the information needed.
Chris, I see you nodding. Did you want to speak to this? You're on mute, Chris.
Yes, we can do that, Andrea. There is always some sort of information that comes with the results. You don't just get a letter with a number. And so we can definitely look at how we can provide information. We can also, in one of our upcoming meetings, Dr. Linda Hansen is a physician that leads our environmental medicine branch. She has been working on the medical outreach for the PEACE community. We could have her come and talk at one of the next CAP meeting and share with what they're doing. And the final thing is, you asked about the NASEM. I just got an update on that today. And they're still shooting for the middle of June to be finished. They've written the document and it's now going to external peer review. And then after external peer review, they have a process for dealing with the comments, but they are still on track for middle of June.
Yeah, I was just going to add as well, one thing I neglected to say was that we also have a clinician who's within our office. We had a little reorganization at ATSDR. So Linda Hansen's group, who's in the other office that's doing some of the creation of materials. We have Michelle Ziegler, who's in our office, and she was part of the Merrimack call and has offered her services as well if a clinician or a community member has a question specifically about their results. She said she would be willing to talk to them. So we did try to build that into, because I know, sometimes the clinician might want another person to talk to, right? Not just like a form, because it might not answer a specific question they have, right? It might not be so specific for that individual patient they have.
So that information will be, that person's name and contact information will be provided to both the PEAS study participants as well as clinicians during outreach. So if they have questions about their individual results, they can talk to this person.
Yeah, I think, Jamie, we were gonna have it so it goes to the study contact information, and then we can get it to Michelle, just to make it so that way we can track what's coming in too. It makes it a little bit easier to make sure the questions that are coming in get tracked, and then we can make sure it's going to the right person, who's probably going to be Michelle. But if, I don't know, if they have another question, maybe something different in the study design, I don't know what people's questions are. We can just make sure it's going the right place.
Sure. And if I could just make one suggestion to Linda Hansen, is that what you said her name is? The physician that's leading up here. Yeah. If she's going to be developing materials or, is in charge of physician outreach, could we suggest that maybe she set up a Zoom meeting with any of the CAP members who would like to meet with her and share some of our feedback, personally in terms of how we've had experiencing, talking to our physicians about PFAS and all of that. I think it'd be really important as she develops tools, not only for the physician, but she understands the community perspective regarding this issue. And if I could suggest that maybe the CAP could help, if ATSDR could coordinate a Zoom meeting with her, so we could just talk and share more information, I think that'd be really helpful.
Yeah, we can probably, I don't want to speak for all of ATSDR, that's Dr. Ray's job. But I think we can probably on one of our calls? Do you think you wanted like one of these calls or one of the meetings, or would you?
A monthly call would probably be more appropriate.
Like one of the monthly calls?
Yeah.
And we could definitely have her come on. She would, knowing her, she would really appreciate the feedback. So good idea, Andrew.
And and I think too, if we could have probably Dr. Ziegler too, as well, just introduce herself so you can be familiar with her. She's been involved in a lot of the exposure assessment meetings where we've had those results released to those communities. So she's pretty up to speed on, questions that tend to reoccur at different sites, like similar types of questions. So, but yeah, we could probably arrange that as well at the same time. I think that should work, right, Jamie? And
Should work.
He's not going to be there anymore, but
No, you'll have to work with Tira. You'll
Well,
work with Tira to.
we'll make it work so that we can, yeah.
Awesome. And I do want to jump to John Durant because I see his hand has been up for a while. And Andrew, we can come back if you have any further questions. Go ahead, John.
Thank you. So I had a question about the exposure piece of it. Could you give us an update on where that's at regarding the exposures to the various participants in the PEAS study?
I'm not sure I understand the question.
Well, there's two parts to it. One is
Okay, go ahead.
PFAS serum levels, right? Which we're waiting for about half of them to come out from the lab. And then there's the historical reconstruction, right? And that was completed a while back. And I think, yeah, you all got a condensed version, at least, of that report. And they have monthly estimates of the contamination levels based on assumptions they had to make, relatively simpler modeling than we did, for example, at Camp Lejeune. And a lot of it's based on that fire that occurred with the KC-135 plane, I think it was, and on the runway in 1990, where 90,000 gallons of AFFF were used and went into the sewer system, the drainage system there, and went right to the well, Haven Well. So we still have that information, and that will be part of combining that with the serum levels. And we're also, as part of the multi-site study, and Marion can chime in, we have a PK group, pharmacokinetic modeling group. And what comes out of that will probably guide us on how we will combine the water modeling data and the PFAS serum data to estimate what the serum levels were in the past, because that's what's also going to be done for the multi-site study. So Marion, do you have anything to add to that?
No.
John, did that answer your question?
Yeah, that's the next question.
I think so. May I just ask one more, if you don't mind? At some point in the past, I was led to believe that the historical reconstruction would yield individualized exposures to contaminants in the water supply. Has that piece of work been completed?
Well, they used a simple mixing model for the distribution system modeling. So we're assuming roughly the same contamination throughout the system. So in that sense, it's individualized. Each person's getting roughly the same contamination at that particular month. Okay. We do ask questions about water consumption in the questionnaire. So that will be used as part of it, the assessment as well. So that brings in more of the individual element too.
And then, if I may, just one last question.
Go ahead.
How are you adjusting for dietary intake of PFAS through food and packaging materials, or are you not doing that?
We're not. No, we didn't ask those questions in the questionnaire.
Okay. All right, thank you.
Thanks, John. I see Laurel, hands up.
Yeah, hi, everyone. I had a question related to the reporting back of the clinical results. I know you have the lab core results, but not the results yet from the SUNY lab. is there a way to report back the results from the LabCorp tests, or are you going to wait till you have the SUNY results before you do that?
Marion, well, I can answer it. We're waiting for the SUNY results and then we'll send them.
Yeah, at this point, unless they are majorly delayed, we would wait. They said March, so we're willing to see if that's March. Otherwise, we would have to mail 2 different mailings.
Okay, let's see. Andrew, you still have your hand up. Do you have another question?
Yeah, I just had a question around, obviously we didn't hit our recruitment numbers, and I just wanted to kind of hear more about if that's going to impact the ability for ATSDR to draw any conclusions or, make any kind of meaningful, conclusions or whatnot as a result of the study. And I think, certainly we got a lot more adults than we did children. So I didn't know if ATSDR can speak to any of the challenges that we may have in terms of being able to give our community some meaningful answers, given that we didn't hit our recruitment numbers.
Well, I mean, go ahead, Mary.
Marion, are you still on?
I thought he was about to answer. Okay. We're going to have wide confidence intervals for the children for many of the endpoints. There's no question about it. But that just tells you that there's uncertainty. But the estimate of the effect is still important. And we'll base our conclusions mostly on that estimate, and as well as any information in the literature that supports that estimate. So that's how we interpret data in any study, and we won't do anything different here. We don't rely on, at least I don't rely on statistical significance testing to interpret results. So the way I look at it, confidence intervals will be wide for the children, much less wide for the adults. But again, the question is, how strong is the effect? Do we see a 2-fold increase in something, or 1.5 increase? What is the effect? And we base our conclusions on that, as well as I said, the past information in the scientific literature.
Okay.
You always want more people, of course. And it's very difficult to recruit children. A lot of the studies that looked at PFAS, at least the earlier studies, they had small numbers of children too, 200, 300. We're having trouble with the multi-site study as well. It's going to be a problem for all studies to get a large number of children to participate.
But Frank, we are combining our data with the multi-site study, correct?
Yeah. But we will release results for Ps as well. So we're not going to just release one big clump of data from all the sites. We're going to be releasing the P study on its own as well. But the multi-site study is another aspect of the research, and pooling the data from all the sites will also be useful. We'll have more children then.
Okay. Yeah, I just wanted to make sure we weren't going to be at the end and say, well, we can't say anything, so we didn't get enough people. It sounds like you can say something with the people that you studied, but again, there'll be some, gaps because we couldn't get enough. But okay, I just wanted to be sure.
Unless all the effect estimates are close to 1, which means that there wasn't any increase in anything, then we'll probably have to say there's nothing there. But no, we'll interpret it just the way I said.
Okay. Thank you for clarifying.
Thank you. Tony, question?
Yes, thanks. 2 questions really. What will happen with the balance of the funding? And secondly, the participants, will they go on to be included in another study, something in addition to the multi-site?
So when you ask about the balance of the funding, can you be more specific about that?
will it be used, will it be provided for other studies? Will it be used within the PEAS community for things, education, reporting?
Chris, do you want to touch on that? See if Chris is on. Chris, are you still on?
Yes, so I don't think there's going to be any balance in the funding. I think the way this was planned is we're using every bit. Since it's federal funding, if there is a balance, then it typically goes back to the Treasury. But I don't believe there's going to be a balance.
Okay, thank you.
Tony, did you have a second part to that question? Did we answer both of them?
No, the second part was regarding the participants in the study, the enrolled participants. What will happen with them going forward?
I think we touched on that a little bit earlier when we talked about the longitudinal, the possibility.
That's the longitudinal part that Andrea asked for, and that's more of the longer term. Depending on what we see, there's a possibility with this and some of our other cohorts that we would follow them in the future. And we call that a longitudinal study.
Yeah.
So we haven't made that determination yet, but it's something we're looking at.
Right. Okay, thank you.
You're welcome.
All right, any other questions from our panelists before we go to the audience? Looking for any raised hands, and I don't see any, so I'm going to ask.
Tony has her hand raised, sorry.
Oh, Tony, did you have another question?
Oh, no, sorry. I'll lower my hand.
Okay.
Thanks for pointing
Great.
that out.
So we'll go to the audience questions. Pam, would you mind giving an update on how the audience can request to ask a question?
Sure, Jamie. The audience can press the raise hand button on their screen or use the Alt plus the Y keys on the keyboard. Or if you've joined only by phone, you can press *9 and you can raise your hand that way.
Thank you, ma'am. Appreciate that. So I will pause to see if we have any attendee questions. Okay, and like I said, we can circle back around near the end of the agenda as well. Oh, I see a hand raised. Pam, are you able to unmute Brian?
Yes, Brian, you should be able to unmute yourself now.
Brian, are you able to? Oh,
yeah,
maybe.
this is Brian. Can you give me 5 minutes?
Sure. So we'll circle back around near the end of the agenda.
I've actually have a false fire alarm here at my house.
Oh no!
Turning it off. I've actually.
All right, Brian. We'll get back to you.
It's related to what you're talking about right now.
Okay. Do you want to go ahead and ask the question?
Yeah. So I'm a participant in the study. Most people probably know me from the water system side of the house. When I got my results, I asked whether I'm willing to be to get another test, because I drank the water and had high levels. The follow-up sampling, when I finally got the results, I think it was October, they were 35% less, which is good news. They're still high, but I was willing to do another follow-up test because it's 2 years since, and feel that, well, that's probably a good thing informationally for the study. And apparently there are no follow-up tests. So it was recommended, see about getting a blood test from your doctor. So I talked to my doctor, I got an order for the blood test. And then I contacted what DHS had, Contact Vista or NMS. I did both of them. Neither one said they do the PFAS blood testing. My doctor didn't know where to blood test. So I'm sitting here with a, potential to do a follow-up, but yet I don't have anywhere to go. So I'm just wondering, can it happen through the study? And, I think it would be, legitimate information for sure, because this is what it's all about, to see what the half-life is and the time for exposure and your reduction when you're not drinking the water anymore.
So I'll let Frank or Marion ask if another blood test can be conducted through the study.
No, but we have, if you participated in the New Hampshire Health Department's biomonitoring at PEAS, we'll have that measurement plus the measurement that we took in the study. So we'll have two measurements on you, and many other participants in the study have also had participated in the biomonitoring. So we'll have two measurements on them too. And that will help us get a sense of half-life and how much the PFAS is diminished after the wells were shut down, the exposure diminished.
So we can't do another PFAS test.
Right.
One, because it's not in the protocol. Is that
Right.
right? So it's not part of the
Also-
protocol for the study.
The study office is closed. Recruitment's over. We're in the process now of getting all the data and moving forward in the analysis stage. So that's so there's no more blood testing by us for the study.
Well, apparently, so where do I get a follow-up blood test?
I'm not sure I can answer that question. I wonder if the state health department could answer that question for you.
Why wouldn't that information be put out to participants?
Well, you already had 2 blood tests. Why do you think that this would change or give you additional information? When was your last test?
2 years ago.
So you want to see like whether it's changed again in 2 years?
Yeah, oh, sure, yeah.
But you already had 2, so you saw it went down. You want to see again how it changed after an additional.
This is Chris Ray. So the best place for you to go is to your doctor or to the state health department. We as the federal government.
I went to my doctor.
But we as a federal government research agency cannot recommend where to go get tests. And so if you're not getting satisfaction from your doctor, then I would recommend giving the state health department a call.
Well, I just listened to the first part of this whole presentation. It's all about getting people information. Why is there not information on where you go to get a blood test? I have an order from my doctor. I contacted Vista, I contacted NMS, I contacted ATSDR.
Right, and we just do not keep a repository of laboratories that are doing PFAS testing. That's just not within our mandate or our purview. So I would recommend contacting your local health department or your state health department.
And follow-up testing is not valuable to the study?
Well, the testing portion of this study has been concluded. So we are no longer collecting samples at this point. We've finished with the testing part, and now we're analyzing samples, and we're going to start analyzing the data once we get all the samples.
And for those exposed and getting results, they are to do what in the future?
Well, that's what we're trying to learn. Unfortunately, we have more questions about PFAS exposures and what they mean than we have answers. And so that's why we're doing studies like this in our larger national health study. And some of the other work that some of the other federal agencies and universities are doing is to better understand what does these exposures mean, and from a health standpoint, and what can people do if they have been exposed. And so one of the things we talked about earlier was the National Academy of Sciences work, which is some work that Andrea was part of, that where we brought together, where the National Academy brought together some scientists to look at what type of physician guidelines and criteria and testing would they recommend for PFAS exposed people. And that work, we're hoping the National Academies is a third party. They're and we're hoping to have, right now they're saying we'll have their report in the middle of July.
Thank you, Dr. Ray. Any other follow-up questions on the PEAS study from our audience? I'm just going to pause, make sure I don't see any more hands. Okay, I do see a hand from Andrea. Do you have a question, Andrea?
Yeah, I guess I want to better understand why ATSDR, if you're going to be doing physician outreach and you're going to be giving people their blood test results, like, why would it not be within your scope to give people resources if they want additional follow-up blood testing, like at least a list of labs that you know can do it? I feel like that is within the scope of what you're doing here in the study, like you're giving people guidance on what to do after the study. Talk to your doctor. You just heard from someone who has a doctor willing to write an order, but he can't find a lab, you know? So I don't know. I just feel like that is in the scope of what ATSDR should be doing. And in your physician outreach and in your results report back to communities, that is something you should share with people, because even if they can't get their blood retested again through the study, they should absolutely, you know, if they want to pursue getting their blood tested elsewhere, it's clearly not a very straight path to do that. It's a challenge, you know? And so why do you feel it's not within the scope of what you do to help community members navigate that? Or at least give them some resources on how they could do that?
Yeah, so we as a federal government agency we just cannot recommend a lab or one over the other. That would be seen as endorsement by the federal government. And so we just do not do that. And so it's unfortunate. I get all the points being made, but being a federal government agency and part of CDC, we just can't recommend one over the other.
Okay. I just think it's unfortunate, because I don't think Brian's alone in his request and his concerns and his questions. And he even said that he used the labs on the state health department's website and he wasn't successful in that. So just referring him back to an avenue that he's already explored and didn't work out, you know, just doesn't feel like you're really meeting his need or his question, answering his question. And again, I don't think Brian's unique in this question or this concern. And I think we need to come up with a better way of helping people be able to obtain that information. So I do hear what you're saying about recommending a lab, but I don't know why we can't. There's not a lot of labs that offer PFAS blood testing. If there's a few that we know, I don't know why CDC can't list the labs and not say we're not endorsing them and not recommending them. Here's some that you can explore, you know, that would be helpful.
I see Laurel's hand up.
Yeah, I just wanted to echo what Andrea just said in terms of, you know, Brian probably won't be alone in asking this type of a question. And I think providing a list of labs that provide this type of service would be helpful if you can do it in a way where you're not endorsing one over the other. I did want to mention also that the PFAS REACH study is putting together a resource with information for people seeking blood testing. And it's actually interesting to hear what your experience, Brian, that's helpful for us to know that that didn't work for you. So I don't know if it's possible for the ATSDR website or your resources to refer to our resource that we put together. We're working on it now and it should be ready in a month or two. And I can certainly share that link if you'd be able to point people in that direction. But yeah, just echoing previous comments that this is a question you'll likely hear. People will want to retest on their own and understand they can't do it through the study just for their own curiosity, exposure reduction, if they're changing habits in their daily lives to see how that's affecting their levels. Some people will want to do that and have the means to do that on their own. So yeah.
Thank
So
you
which
for
lab
that.
do you recommend, Laura?
And so I get the point, and we do hear it, and it's unfortunate that we can't provide a list, but that's just just not good. Yes.
I was just going to make a suggestion. Maybe we could talk with the state health department and see if they can update their list on their website, or if they have any way that
Sure.
they, that way we can still refer to the state, but maybe they have a more updated information on their website. That's something that we could do.
Yeah, that's what I was about to say, but anyhow.
Took the words out of your mouth
You know,
and interrupted you.
There's just so much we can do, and it's a great idea. I wish we could, but it's not going to get past our CDC legal department. You know, the federal government just doesn't recommend laboratories, and but if there's other avenues like the REACH study, there's certainly other avenues where it can be done, and so.
Thank you for that. Any other questions on the PEACE study before we move on to our agenda to the multi-site study? Okay, I don't see any hands, so I'm going to go ahead and move on to the multi-site study update. Miriam, would you mind giving an update?
Yes. So we have all the sites, including California, have started a field collection of samples. All 7 sites are in. Michigan is furthest along with Pennsylvania, some other sites. So we crossed, we're somewhere around 500, 600 total participants enrolled at this point. And so we are in that stage, and making arrangements with again with different labs on the schedule and the continuity of the analysis for multi-site study.
Thank you for that update, Marion. Any questions on the multi-site study? Andrea, go ahead.
So yeah, I was just curious if you have a timeline of when, because I know the plan is to combine the data from all the sites. Obviously, you'll do individual reports at each of the sites, and then the plan is to do kind of a comprehensive report on what's found at all the sites. Is there, I know these other sites we're just finishing our data collection, others are just starting and they're at different phases, but do you have a guesstimate as to when everything would be done?
So there's a couple of ways to look at it. What was planned, what was in the funding opportunity documents, like how long the funding is gonna last, and the reporting, and then of course you have practical matters on when people are in the field and how quickly they're burning the money that they have, and how easy or difficult it is for them to enroll people in their study. So So the funding is for 5 years on this project, right? So we're in year 3. September will be year 4. The current plan for having people enrolled in the multi-site study is at this point the end of May of 2023 for the end of enrollment. So, it would, given, as you said, some starting earlier than the others and completing or not completing. So we're talking about 2024, where the data may be aggregated and put together and start being analyzed.
Okay. And how do you envision releasing the multi-site data once it's all finalized and you've made a report, where it's going to entail multiple communities and data from multiple communities? How do you envision reporting that information back?
So there's a couple of layers to that. Obviously, each site will report to their own community on their own data set. They own that part of data for their site. So that's one part of that. And then, the aggregate reporting, will be done in conjunctions with the consortium and ATSDR leadership to decide, the best way, the most appropriate way to get it out. But since these are mostly, university-based researchers, the idea is that the consortium would produce and prepare, peer-reviewed scientific publications that describe findings. What we had for example, C8 studies or some other NIEHS-funded projects. So it will go more that way than a way of governmental reports that you can't publish. So I think all the researchers in the study are in research and in reporting. So that will be the way of highlighting and spreading the information on the results.
Okay, thank you.
Thanks, Marion. Any other questions for multi-site before we move on? Okay, let's go to Peace Health consultation update with Captain Summers.
Sure. So the PEAS, the final version of the private drinking water well, it was set to be released the 10th, I believe, of February was the release date. And then they ran into some technical challenges getting it in a form that can be out on the website. So Greg's working on that and hopes to be out soon. Again, we're going to do outreach to the local communities. Nothing really changed in this document from when not big changes anyway, for the conclusions for when it was in the public comment version. So I don't think we're going to do the same type of public availability session, but definitely through the town officials, reaching out to them, making them all aware that this document's out there and trying to get the word out that it's there for people. So Andrea, once we have that in the version that's available for everyone on the web to see, we'll make sure you get it so you can post it to the Testing for Peace page, and we'll try to make sure it gets to, like I said, all the homeowners so they can know about it. Looks like, do you have a question? Your hand's up.
Yeah. So will it be put online somewhere, or is it going to be a PDF?
Yeah, we'll have it. We always put the documents on our website, but people aren't really checking out our website very often. So any way we can get it out there, so information that people can go to our website and check it, that would be good. And like I said, I don't think there's anything that you're going to see that looks significantly different than what it looked like when we had the first public comment version. And in that case, we did remember Gary and Greg were there and did a lot of time for people to come talk to them in person with questions. So I think we did a pretty good job at that point, answering a lot of questions. But if new questions come up, we'll certainly answer
Okay.
any questions.
Yeah, I know the Pease RAB, the Restoration Advisory Board with the Air
Yeah.
Force, they have quite a few Newington residents on the RAB. And so it'd be great. I don't know if I can give you the RAB coordinator's name too. I mean, I certainly can share it as well with the RAB members, but I think that's another good avenue to make sure once this document is final and available, to make sure it's pushed through the RAB as well. Because I think there's a lot of key community members that have a lot of interest in this on that group that aren't on this group. So
Yeah, sure. We'll share it with the RAB. I know Mike Daly, he's the EPA. Is he?
Yep,
Yeah.
he's on
Mike-
the RAB. Yep, he's on the
Yeah.
RAB.
So we'll make sure he's aware too.
Okay, great. Thank you.
Sure.
All right, any other questions on the Peace Health consultation for Captain Summers? Okay, we'll move on to the exposure assessment update. I have that, and if I miss anything, Dr. Ray can jump in and let me know. All right, so the update is there was a community meeting held for the Massachusetts site in December of last year. A community meeting was held for the West Virginia site in February of this year. The Delaware report was released in February of this year as well. And the community meeting is scheduled for February 17th, which would be tomorrow for Delaware. The 5 other site-specific reports are currently in our approval process at ATSDR. Did I miss anything, Dr. Ray?
No, I think that's just about it. We think the next one out of the gate will be Spokane, the Spokane, Washington site. But I think you got it.
All right, any questions for exposure assessment? Andrea, go ahead.
Thank you. So Dr. Ray, do you anticipate, similar to the multi-site study, you're going to aggregate all this information and also have like a final report? And if so, do you have a timeline on that?
Absolutely, and they've already started working on this. And I believe the timeline, from the budget, from the way the contracts were written, it will be by the end of this year.
So by the end of this year, like the nation can have a report on all of this exposure assessment data,
I
or,
believe
you
that's
know.
right. Let me get back to you, but I think that's the time frame.
Okay. Okay. And then as a result of this work that you've done in the exposure assessments, is there any additional follow-up work that's being done? I mean, obviously the exposure assessments are different than the health studies. The health studies are ongoing. Are there any other biomonitoring or studies or, you know, any other work that's being done regarding looking at PFAS in blood or human health effects that ATSDR is currently working on? I know in the past you've talked about like possibly partnering with CDC to look at the intersection between PFAS and COVID and lowering immune response and things like that. So just curious if there's any other work that we should be aware of.
And that work's still going on. We also have a joint project with the EPA looking at different sources of exposure. And we're using some of the sites from our exposure assessment to do that. So going beyond just looking at water as a source. You know, through our community health assessment process, we always are interested in sites where there are sources other than firefighting foam. In related to airports or Air Force bases or military sites. And because as we know, there's a lot of other uses of PFAS and a lot of manufacturing processes. And so we do have some sites that show promise for looking at other sources of emission, hence exposure, that are outside of military applications.
Okay. And then I think just one follow-up question, although I don't know if it's like exposure assessment related, but you know, we do know that DoD is collecting the blood of military firefighters in their annual physical, but it's not really clear. I don't think they're doing much with that blood, with that data right now. And just wondering if there's opportunities for ATSDR to partner with DoD, because ATSDR has certainly done a lot of work now on collecting blood samples for PFAS, writing exposure assessments and health studies and all of that. So is there an opportunity for DoD and ATSDR to partner with that data that DoD is currently collecting from their firefighters, so we can try to draw some meaningful conclusions from that, help raise awareness to PFAS exposure to firefighters and DOD, reduce their exposure, things like that.
Yeah, there's a possibility. We work closely with DOD and the VA. And sometimes that work is done by the VA, sometimes it's done by the DOD. And there are some possibilities there that we've had some discussions around. A lot of it's going to deal with privacy issues. And so, but there's possibilities.
Okay. Thank you.
Okay, any other questions for exposure assessment? Okay, we will move on to just general CAP concerns or questions. Anybody have any questions? Tony, go ahead.
Hi, thanks, Jamie. It's a request more than a concern. Can an update be sent to the Portsmouth City Manager, Karen Connor, just on where things stand? Enrollment has closed, final enrollment numbers, the status of things going forward, what are the plans?
So yeah, we could definitely do that. Would you mind just sending an email to Tira with that request?
Sure, absolutely.
So we know exactly what you're asking for and we can do that.
Yeah, great, thank you, appreciate it.
Absolutely. Anything else? Any other questions, concerns? Okay, Tony, your hand's still up. No more questions? Okay, just want to make sure. All right.
Lower my hand.
No problem. I just wanted to make sure. All right. So I just want to say thank you to everybody. This is my last meeting. So I wanted to say thank you. And it's been a pleasure to get to know all of you guys and work with you all. And it's sad day, but I'm sure I will peek back in and ask Chris how everything's going and Frank and Marion and Tira. So with that, I want to say thank you for coming tonight and we will wrap it up.
Take care. Take care of
Thank
yourself.
you guys.
Yeah, bye-bye.
Thank you, Jamie.
Yeah, take care.
Absolutely.
Bye-bye.
Everything.
Appreciate it.
Yep.
Best of luck, Jamie. Thank you.
Thank you.
Okay.
Thank you, everyone.
Bye-bye.
Thank you, Jamie.
Bye-bye.
You're welcome. All right. Bye, everyone.
Bye.
Bye-bye.